The major crises of sickle cell disease are vaso-occlusive crisis. The crisis occurs when sickled red blood cells block small blood vessels, leading to ischemia and pain in any part of the body. Some of the symptoms are bone and joint pains, dactylitis, that is, painful swelling of the hands and feet, chest pain, abdominal pain, limb weakness, which may be due to stroke, priapism, which is the prolonged and painful erection of the penis for hours that is not caused by sexual stimulation. The next is acute chest syndrome. It is a form of vaso-occlusive crisis where sickled red blood cells block blood flow in the lungs, potentially causing lung damage. Some of the symptoms are chest pain, shortness of breath, cough, wheezing, fast breathing, fever, amongst others. The next crisis is hyperhemolytic crisis. It is the rapid destruction of sickled red blood cells, often triggered by infections, toxins, or drugs, leading to anemia. Some of the symptoms are jaundice, dark urine, fatigue, dizziness, shortness of breath, loss of consciousness, palpitation, amongst others. Sequestration crisis. It is when sickled red blood cells get trapped in the spleen, leading to enlargement of the spleen and severe anemia. Some of the symptoms are abdominal distension, abdominal pain, weakness, palpitation, difficulty breathing, and fever. The final major crisis is aplastic crisis. It is a temporary failure of the bone marrow to produce red blood cells, often triggered by parvovirus B19. Some of the symptoms are fatigue, dizziness, loss of consciousness, shortness of breath, palpitation, fever, bleeding, and skin rash.
Don't forget to subscribe, follow, share, and like our platforms. Thank you.